certain amount of bleeding is to be expected following surgery. Slight bleeding, oozing, or redness in the saliva is not uncommon. Excessive bleeding may be controlled by first rinsing or wiping any old clots from your mouth, then placing a gauze pad over the area and biting firmly for 30 minutes. Repeat if necessary. If bleeding continues, bite on a moistened tea bag for 30 minutes. The tannic acid in the tea bag helps to form a clot by contracting blood vessels. To minimize further bleeding, do not become excited, sit upright, and avoid exercise. If bleeding does not subside, call for further instructions. The swelling that is normally expected is usually proportional to the surgery involved. Swelling around the mouth, cheeks, eyes, and sides of the face is not uncommon. This is the body's normal reaction to surgery and eventual repair. The swelling will not become apparent until the day following surgery and will not reach its maximum until 2 to 3 days post-operatively. However, the swelling may be minimized by the immediate use of ice packs. 2 baggies filled with ice or ice packs should be applied to the sides of the face where surgery was performed. The ice pack should be left on continuously while you're awake. After 36 hours, ice has no beneficial effect. If swelling or jaw stiffness has persisted for several days, there is no cause for alarm. This is a normal reaction to surgery. 36 hours following surgery, the application of moist heat to the sides of the face is beneficial in reducing the size of the swelling. For moderate pain, 1 or 2 tablets of Tylenol or extra strength Tylenol may be taken every 4 to 6 hours, or ibuprofen, Motrin or Advil, 2 to 4 200 milligram tablets may be taken every 6 hours. For severe pain, take the tablets prescribed as directed. The prescribed pain medicine will make you groggy and will slow down your reflexes. Do not drive an automobile or work around machinery. Avoid alcoholic beverages. Pain or discomfort following surgery should start to subside mostly after post-op day 3. If pain persists, it may require attention and you should call the office. After general anesthetic or IV sedation, liquid should be initially taken. Do not use straws. Drink from a glass. The sucking motion can cause more bleeding by dislodging the blood clot. You may eat anything soft by chewing away from the surgical sites. High calorie, high protein intake is very important. Nourishment should be taken regularly. You should prevent dehydration by taking fluids regularly. Your food intake will be limited for the first few days. You should compensate for this by increasing your fluid intake. At least 5 to 6 glasses of liquid should be taken daily. Try not to miss a single meal. You will feel better, have more strength, less discomfort, and heal faster if you continue to eat. Caution: if you suddenly sit up or stand from a lying position, you may become dizzy. If you're lying down following surgery, make sure you sit for 1 minute before standing. Good oral hygiene is essential to good healing. The night of surgery, if Paradex is prescribed, use before bedtime. The day after surgery, the Paradex should be used twice daily, after breakfast and before bedtime. Be sure to rinse for at least 30 seconds and then spit it out. Warm saltwater rinses, a teaspoon of salt and a cup of warm water, should be used at least 4 to 5 times a day, as well, especially after meals. Brushing your teeth and the healing abutments is no problem. Be gentle initially with brushing the surgical areas. In some cases, discoloration of the skin follows swelling. The development of black, blue, green, or yellow discoloration is due to blood spreading beneath the tissues. This is a normal postoperative occurrence which may occur 2 to 3 days postoperatively. Moist heat applied to the area may speed up the removal of the discoloration. If you have been placed on antibiotics, take the tablets or liquid as directed. Antibiotics will be given to help prevent infection. Discontinue antibiotic use in the event of a rash or other unfavorable reaction. Call the office if you have any questions. In the event of nausea and/or vomiting following surgery, do not take anything by mouth for at least an hour, including the prescribed medicine. You should then sip on Coke, tea, or ginger ale. You should sip slowly over a 15-minute period. When the nausea subsides, you can begin taking solid foods and the prescribed medicine. Other complications that you may encounter. If numbness of the lip, chin, or tongue occurs, there is no cause for alarm. As stated before surgery, this is usually temporary in nature. You should be aware that if your lip or tongue is numb, you could bite it and not feel the sensation. So be careful, call the office if you have any questions. Slight elevation of temperature immediately following surgery is not uncommon as well. If the temperature persists, notify the office. Tylenol or ibuprofen should be taken to reduce the fever. You should be careful going from the lying down position to standing. You were not able to eat or drink prior to surgery. It was also difficult to take fluids. Taking pain medications can make you dizzy. You could get lightheaded when you stand up suddenly. Before standing up, you should sit for 1 minute, then get up. Occasionally, patients may feel hard projections in the mouth with their tongue. They are not roots, they are the bony walls which support the tooth. These projections usually smooth out spontaneously. If not, they can be removed at the office. If the corners of your mouth are stretched, they may dry out and crack. Your lips should be kept moist with an ointment such as Vaseline. Sore throats and pain when swallowing are not uncommon. The muscles get swollen, the normal act of swallowing can then become painful. This will subside in 2 to 3 days. Stiffness of the jaw muscles may cause difficulty in opening your mouth for a few days following surgery. This is a normal postoperative event which will resolve in time. So here are some final thoughts. Sutures placed in the area of surgery are there to minimize postoperative bleeding and to help in healing. Sometimes they will become dislodged. This is no cause for alarm. Just remove the sutures from your mouth and discard it. If the sutures are not the dissolvable type, then they will be removed in our office in 1 to 2 weeks. The removal of sutures requires no anesthesias or needles. It takes only a minute or so, and there is no discomfort associated with this procedure, so it's really nothing to worry about. The pain and swelling should subside more and more each day following surgery. If your postoperative pain or swelling worsens or seems unusual, please call our office for instructions. There will be a cavity where the tooth was removed. The cavity will gradually, over the next month, fill in with new tissue. In the meantime, the area should be kept clean, especially after meals with saltwater rinses or a toothbrush. Your case is individual and no two mouths are alike. Do not accept well-intended advice from friends. Discuss your problems with the persons best able to effectively help you. Our office or your family dentist. Brushing your teeth is okay, just be gentle at the surgical sites. A dry socket is when the blood clot gets dislodged prematurely from the tooth socket. Symptoms of pain at the surgical site and even pain to the ear may occur 3 to 5 days following surgery. Call the office if this occurs. If you are involved in regular exercise, be aware that your normal nourishment intake is reduced. Exercise may weaken you. If you get lightheaded, stop exercising. Keep physical activities to a minimum immediately following surgery. If you are considering exercise, throbbing or bleeding may occur. If this occurs, you should discontinue exercising. Keep in mind that you are probably not taking normal nourishment. This may weaken you and further limit your ability to exercise. Partial dentures, flippers, or full dentures in most cases can be used immediately after surgery. Follow up with your general dentist for adjustments of your partial, flipper, or dentures, as discussed in the preoperative consultation.